We are starting our session on nuclear medicine imaging. Happy to be in Ain Shams University, and my name is Khalid Nouaim. I am the chair in Alexandria University. We have a distinguished speakers. We are going to start with Dr. Toqa Elsayed. Her topic is about the diagnostic value of F18 label PSMA PET-CT imaging in biochemical recurrence of prostate cancer after curative therapy. Okay, Toqa.
Okay.
انت عين شمس يا Toqa.
عين شمس.
Okay.
Start. Okay. Good morning, everyone. I'm Toqa Elsayed, Assistant Lecturer at Ain Shams University Hospitals. First of all, I'd like to express my ultimate pleasure being among you today to represent such important topic, which is diagnostic value of 18F label PSMA PET-CT imaging and biochemical recurrence of prostate cancer after curative therapy. Starting with clinical overview on prostate cancer. Prostate cancer, unfortunately, is common. It affects 1 in 7 men, making the second most common cancer among men worldwide. Clinical course of disease is quite diverse, ranging from indolent course, low-risk disease, and highly resistant cases. Initially, symptoms may mimic benign prostatic hyperplasia in form of trouble urination, nocturia, straining, and weak stream urine, up to erectile dysfunction and puny aches in metastatic advanced stages. Patients in early stages of disease, while tumor is still confined to pelvis, poses the choice of receiving definitive treatment in form of radical prostatectomy or intense radiation treatment, either external beam radiotherapy or brachytherapy, with the aim of curing the illness. Other adjuvant treatment modalities also used, including cryotherapy, HIFU, chemotherapy, and hormonal deprivation therapy. Unfortunately, 30% of patients will develop biochemical recurrence within 10 years of treatment. It's considered when PSA level is greater than 0.2 nanogram per millimeter in 2 successive measurements in patients underwent surgery, or showing increase of 2 nanogram per millimeter above the nadir in post-radiation therapy patients. Biochemical recurrence often precedes clinically evident recurrence by years. So, early diagnosis of recurrent illness is crucial for redirecting salvage treatment. Although PSA level is a sensitive indicator of disease recurrence, imaging modality is of important role as well for distinguishing local from systemic recurrence. Starting with CT scan, CT scan can evaluate properly for nodal mets, as arrowed in blue, but it has poor anatomical resolution in the treated prostatic bed, and unless the recurrence is very large, it may be missed. Multiparametric MRI, on the other hand, provides better anatomical details of the operative bed and can evaluate for locoregional recurrence and nodal mets as well. On the contrary, PONE scan is of a little value, and it's reserved for cases with very high PSA levels. The diagnostic limitations of these imaging modalities have promoted the use of PET, positron emission tomography. However, conventional PET-CT imaging using choline derivatives and FDG PET-CT has limitations as well in evaluation of the biochemical recurrence in the operative bed. So, recently, a PSMA-labeled PET-CT imaging is widely used. As demonstrated here, this is a case of 2 studies for the same patients. The one on the left is FDG PET-CT, was reported to be normal, while patient was having rising PSA levels. So, on 1 month interval, PSMA PET-CT study was repeated, revealing recurrence in the operative bed, also multiple nodal avid lesions. Here, for more closer look on the pelvic cuts in the 2 studies, notice the accumulation of the FDG tracer in the bladder as arrowed in yellow, interfering with proper evaluation of the operative bed. Then, what is PSMA? PSMA is a transmembrane protein having a significant extracellular component, small transmembrane and intracellular domains. It's normally expressed in normal prostatic cells. However, as malignant transformations occurs, it's expressed in a very huge amounts on the prostatic cells, more than non-targeted expression in salivary glands and renal tubular cells. So, recently it's used by gallium or fluorine, 18 fluorine, labeled PSMA radioisotopes. To date, 68 gallium labeled PSMA is the most commonly used. However, disadvantages of gallium is that it has more bladder activity that may influence the evaluation of prostatic bed. New PSMA tracer 18F labeled PSMA has eliminated this kind of disadvantage due to its hepatobiliary excretion. We conducted a cross-sectional research at our nuclear imaging unit at Ain Shams University Hospital Department, Radiology Department, in contribution with Masr Radiology Center for data collection. A study was conducted on 25 patients referred to us with elevated PSA levels for screening of recurrence. Age of the enrolled patients ranged from 58 to 89, with a mean age of 68.92 years, while PSA level ranging from 0.01 to 43.7 nanogram per millimeter and a mean of 5 nanogram per millimeter. 76.9 of our patients showed positive scans, which was higher than detection rates reported by gallium studies. On a close view on the detection rates at different sites of recurrence, local recurrence was detected in 46.2 of the patients, while regional recurrence were less and visceral lesions were only 11%. Here we can notice the efficiency of PSMA PET-CT in detection of local recurrence, which is due to its improved distinction of ureter and bladder activity from local recurrence and local regional mets that accounted for higher detection rates, hence provide more confidence in diagnosis of local recurrence. We found that the detection rate and sensitivity of 18F labeled PSMA is directly proportionate to PSA levels in local recurrence, regional nodal recurrence, osseous recurrence. However, visceral lesions were uncommon in all PSA groups. Here, I represent some of our cases. Case 1 was a 60-year-old male patient, known case of prostate cancer, underwent radical prostatectomy 2 months prior to study, presented with elevated PSA level. On evaluation of the operative bed, axial CT and axial fused PET-CT imaging revealed PSMA avid residual or recurrent tissue involving post loops indenting bladder base with SUV max of 17.98. And consistent with the stage T2C, N0, M0. Second case, for a 58-year-old male patient with a history of diagnostic prostatic carcinoma managed by radiotherapy. The PSA level was 15.8 nanogram per milliliter. Axial CT cuts and axial fused PET-CT imaging of the pelvis showed normal physiological uptake of the prostate with no evidence of recurrence. However, axial fused PET-CT images of upper chest revealed multiple PSMA avid lesions and distant lymph nodes. Right retroclavicular lymph nodes are in red, subcarinal lymph node, mediastinal and hilar lymph nodes shown on yellow circle, consistent with stage T0, N0, M1A. Stage 3, for a 71-year-old male patient with a history of prostate cancer, received radiotherapy as well, presenting with elevated PS level reaching 43.7. Sagittal fused PET-CT image and maximum intensity projection coronal image showing clear prostatic bed with wide metastatic punis deposits and distant nodal spread with no recurrent active prostatic nodules, consistent with stage T0, N0, M1B. To summarize what we have discussed, 18F PSMA PET-CT showing promising results as effective tool for detecting biochemical recurrence of prostate cancer, especially at low PSA levels. Its enhanced ability to distinguish urinary bladder activity allows for improved examination of lesions near the urinary tract, such as local recurrence and pelvic lymph nodes. Thank you.
أنا سعيدة بحضوري النهاردة للسيشن ديت، والأساتذة الكرام مشرفينا. طبعا احنا عارفين ان المجهود دوت من الكانديدز منا بنتعبها معانا على طول، وأنا اتشرفت بإني أكون هنا. هنشوف دلوقتي الدكتور يحيى